Dental implants have been an option to help people replace missing teeth since the 1970s. Since then, many innovations and modifications have been made, and new technology has helped dental implants get better and better for patients. When teeth are missing from dental issues or injury, or any other reason, they can be replaced with dental implants. Think of dental implants like titanium roots, and that they can be placed in the jawbone to support a single tooth, multiple teeth, or all the teeth. When teeth are lost, the bone that supports the teeth will shrink rapidly at first and then slow down but continue to shrink over time. This makes dentures and partial dentures that depend on bone more and more difficult to stabilize and result in worsening chewing, function, and comfort, and may lead to pain and tenderness. This bone also supports the face and can lead to premature aging from facial collapse. When evaluating a person for dental implants, all the information required is gathered, including dental x-rays, photographs, and three-dimensional images when appropriate. It is also important to review all medical conditions and medications taken currently, in the past, and plan for the future in order to see if a person is a candidate for dental implants. Alternative treatments include adjusting or modifying or remaking a patient's current dentures and partial dentures, or doing surgery in the mouth to add bone and graft, or repositioning soft tissue and muscle attachments to help facilitate the use of current denture and partial dentures. In order to proceed with dental implants, a patient must be willing to take on all the required care and maintenance of the new teeth, which may include more frequent visits to your dentist, repairs and adjustments, and increased and different hygiene methods for dental implants. Dental implants are typically placed by an oral surgeon or dental implant surgeon, and then, after a period of healing, will be restored by your dentist. When working with two offices, each office has a separate fee for the services they provide. It is important for patients to be aware of all the fees and costs involved with their care before they accept care to avoid disappointment and surprise. This is the responsibility of the patient and treating doctors. The dental implants are placed in a surgical procedure, and then after a period of time the implants are restored by the restorative dentist. This period of time ranges usually from 4 to 6 months. There are situations and occasions when implants may be restored sooner, and temporary restorations may be placed immediately if the conditions permit and the patient accepts the risks. The implant is placed by moving the gum tissues off to the side so the bone is exposed, and then the implant site is prepared in a very precise fashion to match the size of the implant being placed. The implant will be surrounded by bone on all sides, and when necessary, bone grafting can be used to replace any missing bone to maximize success. The implant can be placed under the gum tissue during the healing and fusion stage, or may be up above the gum tissue by placing a generic metal disc on the implant that is called a healing cap. If the implant is placed under the gums in the first procedure, a second minor procedure, usually performed under local anesthetic, will be required to uncover the implant or implants. After the gums have healed in a stable position, your dentist will fabricate the final restorations. A period of temporary teeth may be required to establish all the ideal characteristics for your situation. Making the final teeth may take several weeks or months to complete, since each situation required a unique and custom fit of the tooth or teeth to your mouth. The final restorations can be removable, or they can be fixed in position so that only the dentist can remove them in the future. Abnormal biting forces can damage the restorations or the implants and lead to bone loss around the implants and loss of the implants and failure of the restoration. If you know or suspect that you may have extreme forces, clenching habits, grinding habits, and nighttime habits, please inform your team so that a night guard can be made and all measures can be taken to avoid future complications. Existing dentures or partial dentures may be adjusted so that they do not put pressure and rub on the dental implant site. This will prevent injury to the area during healing. Usually patients will have temporary teeth to complete their smile during the healing process. Occasionally, you may be asked to not wear dentures or partial dentures for a period of days, weeks, or months. A soft diet is required for the first couple of weeks after surgery, and sometimes during the entire 6 months of fusion of the dental implants. Dental implants should not be struck by solid food such as raw vegetable, nut, or cherry pit during the first 6 months, because this much force can cause the implant to come loose, and then a new implant will need to be placed. Following instructions is critical for success with dental implant treatments. Before proceeding with the final restorations, your surgeon will confirm the fusion of the implants to the bone with a clinical exam and radiographs. You have a choice of having these procedures completed with local anesthetic, oral sedation, or IV sedation, or general anesthesia. Each situation is unique, and a custom plan will be created for you. Many people decide to have some medicine through the IV to make the procedure extremely comfortable and easy for them. It is important not to eat or drink anything after midnight if you are going to sleep for the procedures and to make sure that you have a ride since you will not be driving home. Side effects for local anesthetic are the same for any dental work. IV sedation and general anesthesia have the risk of drowsiness, sleepiness, nausea, vomiting, aspiration, allergic reactions, vein irritation, heart attack, stroke, pneumonia, and in rare instances, death may occur. Good oral hygiene with regular brushing and flossing is required for long-term success. Poor oral hygiene and a lack of regular follow-up visits with your dentist will lead to failure of the implants. Fortunately, dental implants and dental implant restorations cannot get dental decay, but this is no excuse for poor hygiene. Dental implant surgery can result in some bruising and swelling of the mouth, jaws and neck, bleeding, pain, muscle, and jaw stiffness and cracking, or sores at the corners of the mouth. Fortunately, these things are typically self-limiting and resolve over 1 or 2 weeks. Dental implants provide some of the best options available for replacing missing teeth and have helped millions and millions of people around the world. Dental implants are not without some risks that need to be considered and accepted by the patient before proceeding with dental implant therapy. The investment for dental implants will also be discussed today so that you are fully informed and able to make a decision on the correct treatment for you restoring function, aesthetics, and health. Your dentist and dental implant surgeon will discuss your specific situation, needs, and concerns and tailor a specific plan for you. Thank you for your attention and interest in dental implants.